My name is Eileen Casella-Rider, and I am a clinical subject matter expert here at the ECHO Group. I've worked in the behavioral health field for over 20 years as an outpatient therapist, clinical case manager, a program director, and an emergency services clinician. In my recent career, I spent a lot of time working with electronic health records. I really began to appreciate the value of how we can use technology as a tool to enhance the work of clinicians. What I wanted to talk to you about today is something revolutionary in the field of EHRs. ECHO's visual health record. It's unlike any other EHR I've ever seen. Let's take a look.
This is a snapshot of the VHR. This is a client's chart, and as you can see, there are several different parts. Across the top, we have the client demographic information. This includes who in the agency is responsible for her care. Below that, we have a chronological timeline that runs from left to right, from past to present. Off to the sides are the VHR categories, and these are completely configured based on both your agency's workflow, but also based on your role in the agency. These categories line up with the information in the middle, and here is the heart of the VHR. You can see there's a great deal of information here. So for example, bars are things that have a start date and an end date and can be color-coded. Single icons represent a point in time. One can easily see a story begin to emerge. I'm going to show you how easy it is for a clinician to use the VHR. Judy Quincy is one of my clients who I'm planning to see today, and I can tell this because I have several pull-out tabs here that are designed for me, the clinician. The top one indicates my own personal schedule so that I can look and see exactly what's on my schedule for the day. The second pull-out shows my entire schedule. Color coding is used to differentiate between group and individual appointments. When I'm done with the calendar, I simply close it and come back to Judy's record. So Judy is a client who I'm going to be seeing today. And you can see she came in for a medication appointment on February 19th. And at that time, one of her medications was discontinued. The following week, she missed 2 appointments back to back. And on the first day she had a missed appointment, she engaged in an incident, and simply hovering over the incident will tell me that she engaged in aggressive behavior. We were finally able to get her in for a psychiatric appointment again, and at that time a lethality assessment was completed. And again, simply hovering over the icon will give me information, and it's red because she was at risk of harm to herself. When I click on the icon, I'm given 5 tabs of information. I can see her suicide plan, her plan to harm others, her arrest and abuse history, her risk level, and any comments about what's going on for Judy. Already, I know way more about this client than if I were using any other electronic health record. You can easily see a story begin to emerge over the timeline. For example, I can see that she was admitted to the county hospital for her safety, and a release of information is in place so that I can contact the hospital if I need to learn more. Now that I've oriented you to the VHR, let me take a moment to show you how efficient it makes the most common clinical documentation task, adding a progress note. On today's date, you can see a blue dot that indicates the appointment that we had. When I bring up the screen, I can see a lot of details about this appointment. I can change any information about the session if necessary. For example, if it was a no-show or if I needed to change the duration of the appointment, I could do that here. Now I'm going to add the progress note. The system automatically brings up the correct note based on the service that I provided. In this case, it was an E&M note. When I look at the note, I notice that the system has already brought in information from other places in the record. In this particular note, that includes her diagnoses, medication, allergies, and vital signs. This saves me time and reduces errors. I can also add information about her past family history here as part of the note. I'm done the note for the service, and I save the note. Now I'm going to sign the note. If the client is going to sign, a signature pad can be utilized. Now I'm done the note and I've signed it, and when I come back to the timeline, notice that the icon has changed from blue to green, signifying that I've completed the required documentation associated with this service. Now anyone who views this record can see that the note is complete and signed. Thanks for taking the time to look at the VHR with me today. We just looked at a small portion of the power of the VHR in this video, and I hope you're excited to learn more. I think you'll find the VHR's simple and informative interface will enhance your meaningful use of an electronic health record, make your job easier, and improve quality of care. To learn more and schedule a complete demo, you can visit our website or call us. I look forward to hearing from you.